Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. This morning, our focus is on the Affordable Care Act, also referred to as Obamacare. It's a new health care reform law in America that gives more Americans access to quality, affordable health insurance, and its goal is to curb the growth of health care spending in the U.S. Under the new law, everyone can get health insurance, even if they have a pre-existing condition. The deadline to enroll is March 31st, which is quickly approaching, and needless to say, there's a lot of confusion and questions that go along with enrolling. And here to help us sort things out is Jessica Gathirimu, who is the director of the City of Milwaukee Health Department's Family and Community Health Division. Good morning, Jessica.
Good morning.
Thank you for being here. And like I said, there's quite a bit going on when it comes to the Affordable Care Act, and some people are confused, some people don't know where to start, so that is exactly why we have you here today. Let's start off answering questions for those who have not yet enrolled. Like I said, the deadline of March 31st is right around the corner, so who in fact needs to sign up for the Affordable Care Act?
Well, let me start by saying, first, the Affordable Care Act is an overall law that put into place many health benefits that people are going to be reaping the benefits from. And you mentioned one yourself, that people who have pre-existing conditions now cannot be excluded from health insurance. And so part of this law was to create the marketplace, and that's where people go to shop for health insurance. It's kind of like Amazon for health insurance.
Okay.
So anyone who doesn't currently have health insurance, who resides in the U.S., who is either a U.S. citizen or is here legally and isn't currently incarcerated, needs to go and enroll into the marketplace and review insurance plans.
There you have it. And what happens if people, in fact, are not signed up by the deadline of March 31st?
Sure. So I'm sure many people in your audience have already heard about that there's going to be a penalty or there's going to be a fee for those who have not signed up for health insurance. And the fee it kind of breaks down to whichever is higher, either 1% of your annual income or $95. However, there are numerous exceptions to this, and the healthcare.gov website does go into detail about each of those exceptions, but the one thing to keep in mind is each year this fee is going to increase.
Wow. So, and people will actually deal with those fees at tax time.
Correct.
Oh, yeah, not fun, right? So we know that there were quite a few bumps in the road when the website healthcare.gov was actually launched. And at this point, a lot of things have evened out and millions of Americans actually have already enrolled. So is the website the only way that people can enroll for the Affordable Care Act?
It is not. People, like you said, people can go to the website. There is a call number in both English and Spanish that people can access. They can do paper applications and then mail them in. And then what we really recommend is if any of those make you uncomfortable or hesitant, there are numerous locations within the city of Milwaukee that can provide in-person assistance. And folks can go to resources such as 211 to find their most convenient resource.
And there's also another website that I came across that was helpful in listing a lot of different places around the city on every side of town. That was e4healthwi.org, E4 healthwi.org. And you mentioned several enrollment places. The Milwaukee Health Department, you guys are actually helping out in getting people enrolled and answering questions as well.
That's correct. We have enrollment assisters. We have certified application counselors, and they are located at all three of our health center locations, our Northwest Health Center, Southside Health Center, and Keenan Health Center. And we are also located in many of our community partner organizations where we assist those that already access services at that location, but also do a lot of walk-ins as well. And then we are at the Downtown Public Library on Wednesday evenings.
Yes, I noticed that. You're providing assistance in enrolling from 3 to 5:30 p.m. now through March 26th?
Correct.
Okay, and again, that's at the Milwaukee Public Library Central Branch office on Wisconsin Avenue. And let's talk about the City of Milwaukee Health Department's Community Healthcare Access Program, referred to as CHAP. You guys provide a lot of resources on a lot of different levels. So not only are you helping people out with Obamacare, you help people when it comes to Badger Care, Title 19, food share, energy assistance, the list goes on.
That's correct. We've been providing this assistance for numerous years now, and so when the Affordable Care Act came along and the marketplace, we just added another skill set to our tool bag.
Yeah, it makes a lot of sense, and services are available in different languages to help people. So Hmong,
Absolutely.
Spanish, Thai, whatever the case, everybody's covered.
Right. At our Southside Health Center location, we have 3 bilingual staff, so we can provide one-on-one assistance for Spanish-speaking clients. And then languages that fall outside of Spanish, we can provide either telephone language assistance, or we can occasionally source an in-person translator.
Good to know. And it is important to remind people that enrollment assistance is free and they should never be charged. So anytime there's, something that's going on that's a big deal, there's always some scammers out there. So just definitely want to let people know that enrollment assistance should always be free. What are some of the things that people need to bring with them when they go to enroll?
Well, they're going to need to bring proof of identity. They're going to need to bring some of their income documents like pay stubs, proof of identity, an address such as maybe a water bill, and we can assist in sorting some of this out. So if they don't necessarily have an ID, we can figure out a different method of verifying their identification. We can assist to look at maybe old tax documents and whatnot. So while it's good to come prepared if you can, if you don't have all of that, we'll help you through that.
All right, good to know. There are frequently asked questions because you deal with this every single day. So what are some of the things that you hear the most out there with ordinary, everyday people?
Right. One of the biggest questions I get is, what if my doctor doesn't take Obamacare? And it's getting people to understand that when they go into the marketplace, they're not purchasing government health insurance. They're not purchasing a health insurance plan called Obamacare or called the Marketplace plan, that they're actually going in and shopping for private health insurance. So they get to select a plan that includes their providers, includes their hospitals of choice, fits their budget, and really gets what they need for themselves. And it's not something that the government is dictating for them.
Okay, and I'm sure you always get a common question dealing with the cost and the amount of money it's going to cost them in order to have this insurance.
Right. Yeah, everyone wants to know, how much is this going to cost me? Or, and it really is a difficult question to answer because there's so many factors that go into figuring out what it's going to cost you. There are almost 100 plans in Wisconsin, and then within those 100, each plan has different levels, such as gold, platinum, silver, bronze.
We're back at the Winter Olympics.
Right. So, it really takes time for an individual to sit down. They have to know what they need. They'll want to know who their doctor is, what hospital is convenient for them, maybe some pertinent medical conditions that they're dealing with, and really take the time to sit down, review the plans, review the costs. Some people may feel that they need lower premiums per month, and they're willing to take the chance at a higher deductible. And so they need to weigh those cost benefits.
Okay, makes a lot of sense. And people want to know, what does this cover, and where do I go to the doctor? And you just pretty much explained that in a nutshell, that it will all fall into place once you get past those initial stages of figuring out which plan is going to work for you. And you did say that it's going to be different for some people. Smokers, let's just put it out there, will most likely be paying more money than other people. And so this is a good time, if you've ever thought about it, to stop smoking.
It is a good time. The Affordable Care Act does allow for private health insurers to charge extra for patients that do smoke, and some plans do and some plans don't. And the one nice thing, though, is that the Affordable Care Act also covers smoking cessation assistance.
Like that. And what, in fact, if a person's currently covered under Medicaid or Badger Care, what do they do?
Right. So if they are currently covered under Medicare, so those 65 or older, their coverage remains. Nothing changes.
They don't have to worry about any of
They don't
this.
have to worry
Okay.
about anything.
That's Medicare.
That's Medicare.
Okay.
So then those that are covered under Medicaid, or also commonly called Badger Care Plus here in Wisconsin, there's a few things that they need to take into consideration.
Okay.
Those that are now over 100% of the poverty level starting April 1st are no longer going to be eligible for Badger Care Plus.
Okay.
So these are adults. So they're going to need to transition into the marketplace. So ideally, they would do this, shop for a plan and purchase a plan by March 15th. So then their coverage begins April 1st, and they're never going without medical health care coverage.
Okay.
Those that are under 100% of the poverty level, including childless adults who traditionally were not eligible for Medicaid, are now eligible.
Okay.
So they can start enrolling already in anticipation of their Badger Care Plus beginning on April 1st.
Yeah, I can see where people get confused.
It
'Cause,
is.
I mean, I'm like, okay, like there's a lot, but
There is a
you're
lot.
helping to break it down. So when we ask specific questions, people know what applies to them. So that's what they need to pay specific attention to and not try to understand everything under the umbrella because it's
Absolutely.
just a lot to take in all at once. So what, in fact, if somebody cannot afford to pay for insurance, I mean, they want it, but they can't afford it.
Right, right. So as I just stated, those that earn under 100% of the poverty level are now eligible for Medicaid. So there is that for that population. However, we do know that even those making over 100% of the poverty level, sometimes an added monthly expense can be very difficult. And so if they go to healthcare.gov, like I stated earlier, there's a long list of exemptions, and many of them have to do with economic hardship. And so they can apply for an exemption. And then we also know that many of the low cost and free clinics in the area, they're going to remain in business because we understand that some people do fall through the cracks and they still need that health care.
Yes, and I think before we run out of time, it's important to talk about the importance of preventative health care because, you know, so many times people who were not covered under any type of insurance, they would go for long periods of time without seeing a doctor at all, and then when they really did get sick, it was too late, so to speak. You know, maybe they would find out they were in stage 4 of something when, if in fact you go to that doctor every year and get that much needed checkup, then you catch things early, and that's the key. So
Right.
your thoughts on that?
Preventive health care is essential. So much so that it is included in the Affordable Care Act as a guaranteed service. So anyone who has health insurance that covers preventive care is now going to get free preventive care. So this includes immunizations, it includes blood pressure screening, weight checks, diabetic screening, and these are all important because it saves money, it saves time, and it saves lives. The ability to catch things early before they become a catastrophic illness is essential.
Yes, I couldn't agree with you more. And the good news in all of this is that health plans can no longer limit or deny benefits to children under 19 due to a pre-existing condition. Also, if you're under 26, you may be eligible to be covered under your parents' health plan. And there are a lot of benefits that go along with this. You did mention the 4 categories: bronze, silver, gold, and platinum. But the important thing to note is that the categories don't reflect the quality or amount of care that your plan provides. So everybody's going to get quality health care, and I believe that's what the bottom line, that's what it's all about.
It is.
Well, I thank you so much for stopping by and helping us sort all of this out, and we definitely want people to act fast if they haven't already enrolled and definitely take care of business. Thank you again.
Thank you.
And of course, we want to thank Jessica Gathirimu. She is the director of the City of Milwaukee Health Department's Family and Community Health Division. The Affordable Care Act, or Obamacare, has given millions of people the opportunity for affordable health insurance. This, of course, is especially important to communities of color as they experience high health disparity rates and diminished quality of life. When we return to Our Issues Milwaukee, we'll continue our conversation on the Affordable Care Act and look at some of those disparities with a representative from the Black Health Coalition right after this.